Hello, and welcome to another episode of Movers and Shakers. I'm Diana Dodd, Public Information Officer for the City of Lansing, and with me today I have Kansas State Representative for the 40th District, Dave Buehler. Thank you for being here.
Thanks for having me. Appreciate it.
I'm always happy to have you. So let's just go ahead and jump right in.
Okay.
Today at the County Commission meeting, Leavenworth County Commission, Commissioner Mike Stephen quoted a letter of support that you had written for Project Sandpiper, which is a nuclear power project. And so let's talk a little bit about Project Sandpiper and your support for it.
Sure. So, and I may need to back up a little bit. So in November, some of it actually goes back to September, there's two types of nuclear power that are being considered in the state of Kansas. And I would go on record to say right now, none of these have been approved by the Department of Energy, the Nuclear Regulatory Commission, or the Kansas Department of Commerce, et cetera. But one is called deep fission, and that's one where essentially a hole or a tunnel using fracking technology and oil that's used in oil wells goes a mile beneath the surface. That's not the type of technology we're talking about. That's a proof of concept that the city of Parsons is pursuing. The second one is TerraPower. It's called a natrium reactor, and I think Bill Gates is behind that company. And it's, as opposed to when people hear nuclear, they think 3 Mile Island and these big giant smokestacks or Wolf Creek. It's called an AMR, Advanced Modular Reactor, or a small modular reactor. So the footprint is a portion of the size. But where the Project Sandpiper is, there are states who are interested in that technology. And to begin the dialogue, you have to have several things. You have to have letters of interest and support from local governments, and that includes state officials. So I wrote a letter went 2 copies. One went to the CEO of TerraPower, and the other copy went to, I think his name is Paul Hughes in the Kansas Department of Commerce. That was my letter of interest. And what I basically said was the Leavenworth County Commission had a letter of support. I think maybe the difference there is one commissioner is saying it's a letter of interest, not necessarily support.
Right.
I think that's mincing words. My background or my understanding is this: the United States Navy has used nuclear technology to power submarines and aircraft carriers safely since the 1960s. My personal belief, and I think if I go back and rechannel everything that I put in that letter, is we have immense and growing power generation needs in this country, and this state should be a part of it. We have oil, we have natural gas, we've had some dabbling around in solar and wind farms. Those can only produce a fraction of the power that's required. This is an opportunity to get into new technology and to have the state be a part of it. So that was what my letter was. I certainly am interested in it, and I think we would be foolish to walk away from, or at least not explore that.
Right.
So
I think what Commissioner Stephen was saying, that he felt like you had spoken for them and saying that they were supportive of it when all they were willing to do was say, we want to hear more. But the direct quote I have from your letter says that you wrote, the county commission has also declared the support for Project Sandpiper and Atrium Technology via a letter of interest.
Yep.
So I feel like you clarified it.
Yeah. And again, I think we're mincing words. I think, again, I will just restate this. I think we would be foolish not to explore that as one, for power generation, and two, as a matter of economic growth in this county.
And correct me if I'm wrong, but the communities who already have one, or community that already has one, I mean, the property taxes are lower than other parts of the state.
That is correct. That is very correct.
And I would assume their energy bills maybe as well. I don't know. I haven't looked.
Yep. Yeah. And again, and it's so early in the process. It would be foolish to take yourself out of the game before it even starts. And I think if we try to mince words with "am I supportive, am I not," that type of language is easily recognizable and confusing. And you flip that around to who's reading. minced words from somebody else, they could just as easily walk away and say, these guys aren't really serious about this. So I wanted to make no doubt with the letter that I sent.
Right. And you're not committing to anything by just saying we want to hear more, or, we're supportive of the idea.
Right.
Right. So moving on, so you and I sat down a couple of weeks ago and just chatted a bit. And I was kind of surprised to find out about how busy you are between sessions, not just when the legislature is in session. So tell us a little bit about what you've been working on since last summer.
What I found is when we changed our our budget process a year ago, it accelerated the schedule for everything, not only during the session last year, but when the session concluded, all of the activity that happened from June and actually until just yesterday. So there was a special committee on budget development that met starting in September. That took up a good part of my time, and I'm on that committee because I'm the chair of the Social Services Budget Committee. But then I'm also on the Bob Bethel Can Care Committee and 2 or 3 other interim committees that met over the summer. So there was committee work, but on top of that, the work within my committee, the Social Services Budget Committee, I've got nursing homes, I've got Alzheimer's care, I've got dementia, I've got Department of Children and Families. The list is enormous. That's where 35% of the state's budget is. The last 2 days, I've been trying to take the mess that's been on my dining room table with all these piles of topics. And I finally got to the end of it yesterday, and I thought I would have 8 to 10 priorities from my committee that I would use starting tomorrow, actually. And it turned out that there's 22 items on that list, and I'm going to add 2 more when I get home.
Oh, wow.
So the month of November and December was incredibly fast-paced. The other change, the legislature doesn't officially kick off until next Monday.
Right.
However, it was the second or third week of December, the Legislative Coordinating Council, or the LCC, voted and approved additional committee days for some of the budget committee chairs to start work this week.
Oh.
So I start holding budget hearings tomorrow morning in Topeka. So if you're in the military and D-Day is the day you kick off, that's January the 12th. This is like D-5 or 6. So I've got committee meeting hearings tomorrow, and then also scheduled for Friday.
Okay.
And I've got my first month's worth of committee meeting schedules mapped out, and that has been an enormous task. But it's the only way you can stay ahead of the game. It's just, I am amazed at the pace, and there doesn't appear to be a way to slow it down. I guess you could just not do your job, but it's been fast paced, and I'll be ready for the session for me to start tomorrow.
Oh, wow.
So
well, and you don't have an assistant when you're out of session too, so you're having to juggle everything yourself, like answer your own emails and make your own.
Yeah, and that kind of admin work, I am not the strongest in that regard. My assistant is Francie Hernandez. I have been emailing her and her civilian address, so to speak, and she's ready to pick the ball up on Monday. Good. But it's you have to do this just to not be overwhelmed on day one.
Right. So your committee and your I think that your interest has a lot. You like healthcare, and it's particularly elder care, I think.
Yeah, that's a good part. I don't know. So if you back up time before I got into this, I didn't know that's where my passion would come out. But what I found is, and a year ago when they asked me to be the chair of the Social Services Budget Committee, a friend of mine, Representative Will Carpenter from El Dorado, he's the guy who kind of pushed me to it. And I wanted to stiff arm him, and I wanted to say no. Long story short, I wound up being the chair of that committee. And again, as I mentioned, that's 35% of the state budget. But you're right. Elder care in this state, when you look at population trends and you look at by the years 2030, 2035, 2040, we don't have a problem with too many students in schools. We have a problem with too many people getting older and how we're going to take care of them.
Right.
That is an enormous mountain, tsunami, pick your metaphor, that's coming toward us. It's tied up in anything from Medicaid, Medicare, all the different the professions that take care of those people. And it feels overwhelming at times. So when I say I put my list together, of the 22 things that are on this list, many of them deal with those groups. And the other ones are, that I'm particularly passionate about, individuals with developmental disabilities, the way the state cares or doesn't actually provide services for them is very complicated. And it's frustrating when you see a problem, but you can't fix it, and you can't fix it quickly. It takes time, it takes money, it takes service providers, and all of those things don't happen at once. And for anybody who's type A, a little bit like me, that's really hard to swallow sometimes.
Right.
So,
Well, and one of the things that came out of the big, beautiful bill was
Mhm.
the rural healthcare
Yep.
expansion, $500 million
Yep.
per state. Do you see that money perhaps going toward?
In many of my agencies, yes. Or and for those who don't know it, the one big beautiful bill, whether you like that term or not, $500 million for every state has been earmarked for what's called RHTF, Rural Health Transformation Fund.
Okay.
So every state will get $100 million for the next 5 years, and there were criteria set by the federal government for what that could be used for. So that's bucket one. The second bucket, which Governor Kelly just announced, I think it was last week, Kansas was awarded $221 million additional dollars in grants for specific projects, again, along that same line. And it was in due in part to the timeline, the federal government's timeline. The legislature didn't have any involvement in applying for, saying how those funds would be used. The governor created a task force of 22 or 23 people that came from a variety of places and agencies in the state that said, okay, if we get this money, this is how we're going to use it. What I anticipate happening next week, one of the first things that happens, and it may be in the health committee, I'm not sure where it will be introduced, but there will be some sort of action, legislative action, that says the legislature needs to have involvement in this. I don't know if you want to say control or oversight, but at least some involvement, because to date we have it. And I'll tell you why that's important. If you go back to 2020 or whenever the COVID money started just pouring in,
Right.
I was on a phone conversation yesterday, again, with Representative Carpenter, and here's a comment he made. He said, we had all of this federal money come pouring into every state, and you can't point your finger at one particular thing that money actually did any good at.
Oh.
So not to saying that it was wasted, but there weren't transformational things that were made. So look at Leavenworth is considered kind of in the rural frontier type health environment. We don't have an active hospital.
Right.
One of the things that Representative Carpenter and I were talking about was across this state, and today there are what's known as 3 REHs, rural emergency hospitals, and there's critical access facilities. So with that money, what smaller communities that don't have a large functioning hospital could do is to recreate, whether it's a rural emergency hospital or a critical access facility, and get federal dollars to help build that infrastructure so that you can improve healthcare over the long term. And I think what we're looking at is, can we make a generational shift in healthcare with this opportunity, as opposed to just kind of nickel and diming something? That's the opportunity that we'll have. A lot goes into that, and again, we're just on the cusp of it. But I think what's paramount is the legislature needs to be a part of that process, as either funds are played out for any given initiative. There's things like telehealth, training of the future workforce, the medical and healthcare workforce. It's an opportunity to really kind of reset the landscape in some areas where we are coming up short, so to speak. So great opportunity.
Right.
We talk in after the session's over. I'd be interested to take this question again to see whether or not we made some notable inroads towards it.
Well, I will make a note to ask you again.
Let's do that.
Yeah. But speaking of nickel and diming, let's talk
Okay.
about property taxes, because I know I think residents would use that phrase and say they feel nickeled and dimed. So I know that you've mentioned, and I know that city councils, the county commission, everybody has been talking about how lowering property taxes. And I know you mentioned that was one of your priorities, and I think it's one of the legislature's priorities. It's Secretary of State Schwab has come up with the BALD
9-point plan.
Yes.
Yep.
So let's talk through that a little bit and see, what items you think have merit in the BALD. And for our listeners or viewers, it's better affordable living by decreasing property taxes is what BALD stands for.
Right. Yeah. And so for anybody who's watching this, if you Google Scott Schwab BALD plan, it'll come up. It's a 3-page PDF document. Let me back up a little bit though.
Sure.
So if I talk about what I think the top 3 priorities are for the legislature, the first one is property tax. Property tax reduction. The second one that the House and the Senate will have is to create a budget that reduces spending by an additional $200 to $250 million over last year's. And then the third one we just talked about is the Rural Health Care Transformation Fund. So hopping back up to property tax, what I would say about Scott Schwab's plan, and he is running for governor, and I'm not endorsing anybody for governor, but he is one who said, here's my plan. There's elements that address the Board of Tax Appeals, and if you win an appeal, then the government should pay all your expenses for that. He's got a plan to reduce the state mill levy, number of mills from 20 to 5. That's I'm trying to think all the other components.
Well, one of the ones that stuck out to me was a tax refund for misassessment on sale. So if a homeowner sells their property for less than what the tax assessor says it's worth, then you get a refund.
Yeah. So here's what I'll say about Scott's plan. And again, I think I've said this before. If you're in the legislature, I've got my little device here. If your intent is to create legislation to make a pen, and you start that legislation on day one of the legislature, by the time you get to April or May, it turns out to be a pencil. So what you start with isn't what you always get. What I would say is, and with regard to what's out there with property tax, I think there are elements of Scott's plan that are intriguing. One that we haven't talked about is I talked to a gentleman named Kelly Estes. He's from Pratt 2 days ago. Spent an hour on the phone with him. He is a John Deere implement dealer.
Okay.
And during COVID, they started it's called KDDA. It's the Kansas Deere Dealers Association. This is a grassroots effort that is out there working on property tax reduction.
Okay.
They are working directly with Adam Smith, the chair of the Kansas House Taxation Committee, and Karen Tyson, who chairs the Senate Tax Committee. And so they're working, and they've sent out survey responses. I may put in my next newsletter. There's a link that it's called Heartland something. You click on it, and then you can put your county in, and it will show you what the assessed valuation increase average is for your county over the last 5 or 6 years. And I think Leavenworth County is 33 or 34%.
Right.
It's one of the higher ones in the state.
Right.
But in that conversation with Kelly, we talked somewhat about Scott's plan. We talk about the cap that was voted on in both chambers last session, and we kind of left it. We left that legislation there for us to pick up and come back to. I would expect that when you look at all of those property tax ideas that are out there, the property cap will be something that's debated vigorously and will come up for a vote. And I hope it passes this year. There's also a possibility of a set aside, and I'm not sure exactly where these monies would come from taxing entities that are maintaining revenue neutral or having challenges meeting revenue neutral.
Right.
And if they've demonstrated fiscal conservativeness to that end, then there would be a pot of fund to help some of those entities bridge the gap, so to speak.
Okay.
There's another component of it that says this is actually a tax shift where you would use a portion of sales tax that would enable the state to reduce the state mills from 20 to 5 right off the bat, right off the top.
Okay.
So that would be a tremendous boon to each and every homeowner if your assessed mills, if 15 of them came off from the stop,
Right.
from the top. So that salad of or buffet, whatever term you want to use, of tax options is out there. It's conceivable that some of this legislation would have to, like the 20 to 5 mil reduction would probably be in the form of a new bill that would have to be introduced.
Okay.
The property cap or property valuation cap that was debated this last session is still alive and is still conferenceable.
And
So,
sorry to cut you
okay.
off, but that, just to remind everyone, the cap was, it would be, they could raise your taxes no more than what, 3 or 4%?
3%.
3%.
Yeah, and there were different versions. The House version was a 6-year rolling average, which, and that came from Chair Smith in the House. The Senate version, I think, was a 4%, and we never could get together on that. There's another component that I forgot. Also in this discussion is rolling back the assessed valuation to the year 2022.
Oh, right.
So if you think of what's happened from 2022 to now, it's been 13, 14, 15% a year in this county.
Right.
So the starting point of the cap would go back to the 2022 level as opposed to 2025. Again, that's another one of those buffet items that's out there open for debate and discussion. Again, I every time I've tried to predict success, I've been sadly disappointed when it comes to tax. But I do think it is still the number one voter identified issue. There's a lot of anger over this issue. And when you think of for example, the RHID stuff here in Lansing,
Right.
Right, wrong, or indifferent, that voter anger over property tax is what drove a lot of the opposition to it. And I guess I want to say one more thing about property tax. The cynic in me would say that a cap is a license to raise your taxes 3% every year.
That's what I said when I heard it.
Yep.
Yes.
And it feels like that. So the challenge goes back to each and every taxing entity, whether it's the city of Lansing, the city of Leavenworth, Leavenworth County. You've got to take a good, hard, long look in the mirror and try to figure out a way to reduce spending. At the state level last year, we reduced, I think the precise number is $212 million. The target this year is to cut spending an additional $200 to $250 million. That's going to be hard to do, but that's the challenge as a budget chair that I have going in to work tomorrow, I guess.
Now, there are those who have said that the initial 212 that you already cut last year is going to run the state into the red in the next few years. And we're talking about reducing it further.
Yep.
So how do you answer that?
Okay. So the first way I will answer that is and those are based on what's called the CRE, the consensus revenue estimates.
Okay.
So what I would say is, and I'm gonna channel in my mind Chairman Adam Smith. Usually year 1 and year 2, because they go out, I think, 5 years.
Okay.
Those estimates are pretty accurate, or they can be pretty close. But you get out to year 3, 4, and 5, and they're notoriously wrong, and they have been. And I think it's the year 28 or 29 right now that shows us going into the red. So that's the first point. The second point I can tell you is the consensus revenue estimates in the last 4 years have been notoriously wrong. In other words, the state has brought in more money than what was projected.
Okay.
So we end with a surplus, and that's contributed to our rainy day fund. So that's step 1 and step 2, or points 1 and point 2. The third thing that I would bring up is it's possible for us in the House or in the legislature to find ways to invest money in certain programs and reduce overall spending. And I'll give you a good one that I just got data on today. So last year in my committee, we had a proviso that was for something that's called nursing homes without walls. So
Okay.
think of Alexa in your parents' or grandparents' home
Okay.
that can monitor blood pressure, vitals, and other things. So the data that we got back yesterday on the pilot program, so a person who is and the idea is to keep older adults in their homes
Right.
and then still have access to healthcare, or at least some monitoring of the healthcare. So the average cost for a person in a nursing facility on Medicaid, I think, is $110,000 a year per person.
Okay.
So using the nursing homes without walls technology, that cost to the state is $6,500. So there's over $100,000 per year per savings per person by investing in the right technology. I look for those kind of things in my committee, and so they're not part of. In this case, it would be KDADS, Kansas Department of Aging and Disability Service. It's not part of their budget, but that is a proviso that the group Nursing Homes Without Walls came to me in the summer of last year and said, hey, we'd really like the state to consider using state general funds to fund this, and we'll provide you the data for how it works. So it's a wise investment. And there's a ton of places. We did one, I'm trying to think, it was either dementia related or Alzheimer's related last year. And again, it was the same principle that essentially every Alzheimer's patient in this state will make at least 2 to 4 visits to an emergency room every year for some healthcare problem. And this was training. I think there was a training module that was used in investment. You could quickly do the math and I think it was like $500,000 or $600,000, something like that. It's really easy math when you do a rough estimate on the number of Alzheimer's patients and just reduce by 1 the number of emergency room visits, and it pays for itself. And so I'm going to continue to look for things like that. The other ways to get there are taking a serious hard look at hiring additional full-time headcount in places. But each of the budgets and budget chairs has to do that. There's higher education, there's mine, social service budget, there's ag and natural resources. I think the House has 26 committees. Don't remember exactly how many of those are budget committees. But each one of those areas has got to apply that same level of scrutiny to the spending, and we can do it. Sadly, I know I'm rambling, so
You're fine.
I'm gonna keep going here. What I have found is, and I'm not criticizing the people who run these state agencies, but they don't often view themselves as a steward of Kansas taxpayer money. Or they place in the hierarchy of priorities, it's the prioritization of the agency above what's the best fit and use of these dollars for the state.
Gotcha.
And I get it. I saw this when I worked with the Defense Logistics Agency in my military career. When it's taxpayer money, it's easy to spend. But we can't look at it that way. We've got to look at it as my money, it's your money, and we have the needs of Kansas that we have to support and provide. But we don't have an unlimited pocketbook anymore.
Right.
So.
Right. Which kind of leads me to you brought up RHAD earlier, and we're having a groundbreaking for a new subdivision next week, Monroe Manor, which is using an RHID. It's limited as compared to the one that was going to be off of McIntyre.
Yep.
Because this one's 6 years, $3 million to pay for the infrastructure. But how do you balance supporting, because it sounds like you do, incentives like RHID against trying to lower property taxes?
I think it's all about the terms. And I think you and I might, in a previous conversation, talked about this. Let me get the time frame right. probably October of 2024, I was having a conversation with then Councilman Dan Clemens.
Mm-hmm.
And Dan was talking to me. No, actually, I had a constituent call or email me first and was calling all up in arms about the RHID projects. So I need to educate myself. So Dan very graciously I went over, picked him up at his house, and we drove around. He said, this is here, this is there. And then we started talking about the terms. And the terms of that first project were in no way, I don't want to mince words. Those were very heavily skewed towards a developer as opposed to the city. So I think you have to find the right mix. The project has to be right. The terms have to be right. And you have to calculate that impact. And I've also said, and I don't know how you factor this in. I do think we have to consider the outrage over property tax. And I've said that all along, because sometimes even with the best economics, the fact that people have seen their property taxes go up close to 40% in the last 4 years is close to criminal. People should not be in a position where if they own their home, they're paying rent to the state of Kansas just to live in their own home. So anyway, that kind of gets back to that circular loop over what do we do over property taxes. But I think there's a lot of things in works to where we can start finally addressing that, or at least making a serious dent in the way we've approached it in the past.
Well, and it wasn't just one thing that caused property taxes to go up. I
Right.
mean, city councils or,
Yep.
local governments didn't just say, we need more money and therefore we're
Yep.
going to raise. The real estate market factored
Yep.
heavily into that through COVID when we saw these huge jumps in home sale prices
Yep.
and what people were willing to pay. And that made the market values go up, which means your valuations go up, which means your taxes go up. So it was sort of a perfect storm.
But it still comes back to spending, because you can reduce spending by reducing the mill levy to a certain point. I mean, taxing entities can do that. And again, that goes back to that cynic's view of a 3% property cap. That is a 3% license to raise spending every year. And that's not the mindset we have to be in. And again, I think the city of Lansing has done a great job over if you look at the last 5 or 6 years in trying to hold the line on spending. I don't want to be openly or outwardly critical of any taxing entity, but because they have to make spending decisions and priorities of their own. But I think at some point in time, when people are telling you we're hurting, you can't keep raising your spending 15% just because you can.
Right.
You need to show a little fiscal discipline.
Well, and with those market rates going, market home sale prices is what I'm trying to say, going as high as they did, it priced a lot of people out of the market, especially our medium income earners. And I think Lansing has done a good job of trying to get in attainable housing with Covington Woods. Fairlane Townhomes is going to build a second phase, and now, Monroe Manor.
Yeah. So there's another element when I was talking to former Councilman Clemens about and it did go through the school and the school board. So I do think a firm understanding of whether it's as projected or real as can be, impact on the school district has to be known. And I think in all candor and fairness, I think the school district did a reasonable job of saying, okay, if you have X number of homes and you can assume there are going to be this many children, can we absorb that in the existing physical infrastructure at the school districts? And I think that's a part of that equation too.
Yeah.
For any RHID project now and any in the future, you have to consider the impact on the school districts.
True. And on city services too. I mean, being realistic.
Yeah, exactly.
Yes, you do. So let me see. I think we've run through most of what I wanted to ask you. So you're ready to hit the ground running next week?
Tomorrow.
That's right.
It starts
you
tomorrow.
did. You told me tomorrow. That is true. So I look forward to having you back soon, maybe after the session has started.
I would like to talk about one of the projects that you asked me what has, if you have a few more minutes.
Of course.
So again, that time frame from May to the end of December is the opportunity for the legislator to actually work outside the boundaries of bills that are coming to you in committee. And I can tell you, at least me personally, back in June, the first trip I made was to the Osawatomie State Hospital because we have a problem there with contract nursing costs.
Okay.
I'm not talking about that one, though. That's maybe for another day. That's a big problem for the state, and that's something that I will be working on this year. But one of the ones, I'm trying to think, when I first heard about this, it was in August, I believe. So University of Kansas Medical Center has their cancer center,
Right.
but they also have and that's a certified cancer center, and there's criteria for that across the nation. They also have the Alzheimer's Disease Research Center, KUADRC. So roughly back in August, this is something I've kind of overlapped with Senator Klemp on as well. There's a doctor there. His name is Dr. Jeffrey Burns, and he has been working on methods to change the diagnosis and delivery of care for Alzheimer's patients that I think is truly revolutionary. And so here's what the basic idea is. Today, if you suspect you or a loved one has Alzheimer's disease, or you're in that early stages, it takes about 18 months to 24 months to get confirmation of, yes, you have Alzheimer's disease.
Which sounds just terrifying.
It does, but if you think about it, it's because of, okay, you suspect you have symptoms. You have to go to a neurologist. You have to get an appointment with a neurologist. Neurologist comes in, does a consult. They want to do a CAT scan or an MRI or whatever variety and battery of tests that goes along with that. By the time that neurologist, and again, I say doctor of neurology or specialist in Alzheimer's, says, yes, you in fact do have Alzheimer's, it's 18 to 24 months. So there are 2 or 3 things that Dr. Burns has been working on in conjunction with advances in science that can take that 18 to 24 months to 2 hours.
That's incredible.
It is incredible. So there's 2 or 3 new Alzheimer's, and that's to help stave off some of the ravages of Alzheimer's in the early stages. So there's 2 or 3 drugs one was approved in 23, another one just last May. The second component, there is a new MRI. There's new MRI equipment. It's a small device. I've only seen a picture of it, but I met with Dr. Burns at the Disease ADRC back in October, November, together. But it's a piece of equipment that a nurse can run. So they can run you through a battery of tests in your doctor's office, in your primary care office, and that diagnosis of Alzheimer's can literally happen in 2 hours. So what's the ask of the legislature? There will be an ask for some state funding. I know the number that he threw out to me. It's not exorbitantly high, but I'll just hold it for that for now, to see what we can ultimately make happen this session. But it's to change I think the words he uses is the delivery care model. So for us to make that work in the state and the nation, you have to provide the equipment to the primary care offices. You have to provide the training to the staff, the nurses and others, how to use the equipment and how to provide the right diagnosis at that level. But that is, in the simplest way of describing it, that's what's different. So you don't have to go to a neurologist or an Alzheimer's specialist. You can compress that time frame and then begin treatment within a matter of a week or so, or whatever it takes.
So it's a definitive diagnosis,
Yep.
not we're 90% sure
Yep.
you need to see a
No,
neurologist.
it's definitive diagnosis.
Okay.
So what they have, and I know I'm simplifying all the work that they've been done, but he's been working on this for over 20 years, I think.
Right.
And it is really exciting. So when you ask me what I do during the off session, this is one of the things that I've been focusing my time on. And again, it's due in part to my role as the chair of the Social Services Budget Committee and as a member of the House Health and Human Services Committee.
Right.
But if you think about downstream effects, anybody who it may take 2 years to get a diagnosis of Alzheimer's, and you see that cognitive decline
Right.
and all of the life changes that and expenses that people make when that happens. This is an opportunity to kind of arrest that process,
Right.
and then prolong the some of the other parts of the condition that go with the disease. So that's one thing. That's on my list of 22 of 22
that
Soon
are about to be 20.
It's going to be 24.
Sure, yeah.
The other two are, one of is the, and I don't know why I forgot this. It's an optometry scope of practice bill,
Yes.
which I've carried on the House for the last 2 or 3 years. And there's another one, a naturopathic scope of practice.
Naturopathic?
Naturopath doctor
No,
scope
I'm
of
not.
practice.
I'm not familiar with that term. What's a natural?
So a naturopath is they have their own licensing. They're not an MD, but they're a doctor, a naturopathic doctor.
Okay. So
They can prescribe, they can treat. The most common school, I think, is in Arizona.
okay.
So if you Google naturopath doctors, they approached us last March or April in session and tried to get a hearing on a bill. And I think don't remember exactly if it's just a prescriptive authority that they're looking for. But again, this is one, it's very much like the optometry scope of practice. Kansas is in the 1960s when it comes to some of the credentialing and what you can do and what you can't do. I met with the naturopath doctors. They had an open house in September, and so where the fight would come, it might be from the Kansas Medical Society or others who see an encroachment on their turf. But there's places for everybody here, and it's all to me about patient choice or your choice in your care.
Right.
I talked to several patients there who had life-altering improvements in their overall health by using the naturopath remedies as opposed to going to an MD.
Right.
Anyhow, and that's one of the other two that I haven't added yet.
Right. But it just gives people more options.
Yeah.
Right.
Yeah. So, and again, I know we're going over time, but
Well, we didn't really have a time.
Well, okay. So when I think about healthcare, I put a line from north to south, from Salina west,
Okay.
and you think about the truly rural and frontier areas of this state where you got to drive to Oklahoma or Colorado or Wichita to find a specialist or an ophthalmologist or
Right.
maybe advanced dentistry. Then you come maybe to the eastern side and maybe some parts of like Wyandotte County where you might have impoverished areas that still have voids of healthcare. So to me, it's all about, it's improving the access, it's making it more affordable, and you can't always do that with the existing healthcare models. They just aren't responsive enough to it. So we owe it to ourselves to at least noodle around the edges on those and say, okay, does this make sense for Kansas? So anyhow, I went on way too long.
No,
I'm sorry.
you didn't. I appreciate it.
Mhm.
It helps to know everything that's happening,
Yeah.
not just what
Yeah.
has to do with Lansing
Yeah.
exclusively, because
Well, and yeah, so the way I view this, when I look at the work I do in the 40th district, I mean, if you look at concentric circles, the first one is, how does this affect the people I live with in the Leavenworth Lansing area? You come back up, maybe this part of the state, maybe a little higher to the entire state. And if you put that lens on and you make improvements across either that small lens or the big one, we're still going to win for the state. And just try to make it as affordable as possible.
well, I'm really excited to circle back in a couple of months, hopefully, if you're not
Yep.
too buried,
No, we'll do it.
and find out you know, where you
Okay,
are, where
sure,
you are in your uphill
sure.
swim.
And I know in some former roles where we've had our paths cross in the Capitol during the session, it will
Yes.
be, and I hope that happens too. But
Yes.
I know it's going to be very fast paced, very hectic. I know the due date into appropriations for all budgets is around the 12th or 13th of February, so we're on the clock already to get the state's work done.
Well, and you went over last year
We did.
trying to get the budget solidified. There was a lot of back and
Yep.
forth. So, do you think that's going to happen again?
No, I think we'll be done. There is a strong message that is coming both out of House and Senate leadership that, and we've made changes to the budget process to make it better. Unlike last year, where the House started and drove the budget process all the way up until the middle of February, the Senate, and even before that, we've had the special committee on budget development that started meeting in late September, October. So we're much further along and have heard all of the, I'm going to call them the draft budget proposals from the agencies. That last one was done on the 11th of December, I think, somewhere in that time frame. So we've all seen the kind of the big picture, and now it's down to getting to work with each of the individual agencies that we have. And the other part of that is where the House started and drove the work from the first part of January until about the middle of February. The Senate Ways and Means kind of sat on the sidelines and said, okay, we'll wait to see what the House hands over to us. The Senate has these smaller committees of 2 or 3 people that will begin working on the budget process, budget development at the same time.
Okay.
So that body of knowledge will be closer, tighter, and this is the idealist in me, that by the time we do get to that day in February, that it'll be a better product going into appropriation.
Good. You streamlined the process.
Yep.
We didn't even talk about the big announcement.
Which one?
The Chiefs
Oh,
going to
Do
Wyandotte.
you want to do that?
Well, we don't have to get into it heavily, but
Okay.
you want to give me a quick prediction? Do you think this is going to be a good thing for Lansing? Do you think we might, see some?
I do. And this is one of those things where, I have to rewind to the summer of 2024 or even the session of 2024 when the initial discussion and dialogue came up about the Chiefs and the Royals being serious about moving out of their current locations. I was a little bit skeptical. They're never going to leave Kaufman or
Right.
Arrowhead until June of 2024, when the law firm that represents the Chiefs and the Royals came to the House and the Senate and said, we are serious. This is what the Hunt family is proposing. And it's not that they were trying to hold anybody hostage, but they looked at the physical condition of both of those stadiums and said, at best, they've got one more renovation, and then we're at a point to where there is a point of no return.
Right.
So that's when it was on the special session in June of 2024, we voted on and passed the use of star bonds
Right.
as the means to attract them to Kansas. And that process kind of goes through the lieutenant governor's office. And then lo and behold, they make their announcement. And the House was very serious. We're not going to extend this, let them draw. Both of those teams need to be in a new stadium in the 2031 season.
Right.
And when you do the math, the engineering math on what those projects would take, they had to make a decision, which they did. What I've been surprised, and so I would say this, 2 observations. Number one, when that initial dialogue of in 2024 happened, I've never had my email blow up so positively and favorably on any single issue.
Wow.
Like 99 to 1. So what I've been surprised by is since the announcement, there are all kinds of pundits, I think, who are, it's one of 2 things. They're either reading doomsday into it,
Right.
or at least kind of poo-pooing the economic benefits, or there's still those who are very, very enthusiastic about them coming here. So, and there's a lot of chatter on social media about it, which I have stopped reading because
Right.
it will make your head spin. But I do think, to your question, I think it's going to be a good thing. So no one wanted to hear the Salt Lake City Chiefs.
No.
So or the Nashville Royals.
No.
Those were two locations, two cities that were actively courting our professional sports teams. So it's still the Kansas City metro area. There was going to be a new stadium involved. You look at, and there's a lot of pundits that want to debate whether or not star bonds are right, but you look at the Legends and you look at the Speedway among the two most successful. And then our own mall area,
Right.
Which Senator Klemp was the driving force in that. It's a great way to get the Chiefs here. So.
Right. Well, whether or not I ever actually go to a game, it will be a whole lot easier if I decide to.
Exactly. Exactly.
Well, thank you again. I really appreciate you coming,
Yep.
and I will probably see you in Topeka.
Okay. I look
and we'll
forward to
do
it.
this again before the end of the session, or maybe right after the session.
I look forward to it.
Okay. This is Movers and Shakers. Thank you for watching.
Thanks, Diana.
Thank you.